Hello everyone, I am Dr. Sandya, a consultant obstetrician and gynecologist. I practice at IRA Women's Health and also at Cloudnine Hospital, Sarjapur Road, Bangalore. Through this space, I am here to share my expert insights on women's health, pregnancy and beyond. Let's make health easy and empowering together. Heavy menstrual bleeding by definition means a loss of more than 80 ml of menstrual blood that interferes with women's physical, mental, emotional and social well-being and also affects her quality of life. What do you understand by heavy menstrual bleeding? This means when you are requiring to change your pad or tampons every 1 hour, or in case if the bleeding extends more than 7 days, or if you need to use double protection, or in case if you are passing clots bigger than a rupee coin, all this will account for heavy menstrual blood flow. So what are the common causes of heavy menstrual bleeding? It could be hormonal imbalances, it could be thyroid disorders, or it could be conditions called as fibroids or endometrial polyps, or there could be thickening of the endometrial lining which when sheds causes heavy menstrual flow, or sometimes patient could be on certain drugs which causes heavy menstrual bleeding as such. So now what do we understand by fibroids? Fibroids are nothing but benign tumors which occurs on the body of the uterus, or it can be inside the uterus or it can be outside the uterus. So usually the fibroids which are on the body of the uterus or indenting towards the uterine cavity or the inner lining of the uterus is what usually causes the heavy menstrual bleeding. And the small structures that you can see inside the uterine cavity, these are referred to as endometrial polyps. Again, irrespective of the size of the polyps or the number of the polyps, this again can cause more menstrual blood loss with every cycle that the woman bleeds. It can also be associated with other hormonal disorders or thyroid disorders. When there is coagulation factor abnormalities, again the heavy menstrual bleeding can set in. Why should you be worried or concerned about heavy menstrual bleeding? It's not always because of the inconvenience caused due to heavy menstrual flow. When it is left untreated, it causes fatigue, it causes drop in hemoglobin, and eventually it affects daily quality life of the women. Don't suffer alone. When you notice you are bleeding more than usual, please remember and go consult your gynec as soon as possible. Once you come and visit us, we may ask you to run through certain blood tests and we may do simple ultrasounds. By this, we will be able to detect your status of hemoglobin, whether you have anemia, how significant was your blood loss. We will also check your thyroid levels, we'll screen you for coagulopathies, and we'll do the ultrasounds to detect those most common causes which I explained earlier, whether those are present or not, or in other words to find out if there is any structural problems with your uterus or ovaries that can be picked up on the ultrasound. So once we have the diagnosis in hand, the management is simple. Based on whatever the cause is, we will treat the cause, and once the treatment is started, I am 100% sure that patients will show significant improvement eventually. Treatment options can be as simple as prescribing iron tablets, or it could be just prescribing a thyroid supplement. In case if there is a fibroid, and depending upon the location and size of the fibroid and how symptomatic the woman is, we may address that issue by surgical removal, or it could be managed with hormonal supplements. And there is also a newer option called as IUCD or Mirena, which can be advocated to women with heavy menstrual bleeding in case the endometrium or the inner lining of the uterus is detected to be a problematic case in this particular patient. In some cases, we may also advise minor surgical procedures or even removal of the uterus, depends upon the cause again. So stay informed and stay empowered. Do not suffer alone. Do consult your doctor and get evaluated as early as possible.